Every type of diabetes explained one word, diabetes, and yet it covers at least 7 genuinely different diseases, some of which have almost nothing in common except one shared result: too much sugar sitting in your blood with nowhere useful to go. Some of these you're born with, some you develop, one only shows up for 9 months and then vanishes. Let's go through every version, one at a time, and actually understand what's different about each one. The basic mechanism. Before any of this makes sense, you need one hormone: insulin. Insulin is made in your pancreas, and its entire job is to unlock your cells so sugar from your bloodstream can get inside and be used for energy. Without insulin doing its job properly, sugar just piles up in the blood instead. And over years, that excess sugar quietly damages your eyes, kidneys, nerves, and blood vessels. Every type of diabetes is really just a different reason insulin isn't doing what it's supposed to do. Type 1 diabetes. This is an autoimmune condition, and it usually shows up in childhood or the teenage years, though it can technically start at any age. For reasons that still aren't fully understood, the immune system decides the insulin-producing cells in the pancreas are a threat, and it destroys them permanently. Within months, sometimes within weeks, the body goes from making insulin normally to making almost none at all. There's no prevention, no cure, and no lifestyle explanation. It's not caused by diet or weight, which is one of the most persistent misunderstandings about it. People with type 1 need insulin injections or a pump for the rest of their lives, full stop, because their body simply can't produce it anymore. Roughly 5 to 10% of all diabetes cases fall into this category. Type 2 diabetes. This is the one most people picture when they hear the word diabetes, and it works completely differently from type 1. Here, the pancreas is often still making insulin, sometimes even making extra of it, but the body's cells have become resistant. They stop responding properly to the insulin that's already there. Over years, the pancreas tries to compensate by working harder, and eventually it can wear down and start producing less. Type 2 develops slowly, often over a decade, driven by a combination of genetics, weight, activity level, and age. It's manageable and sometimes even reversible in its early stages through diet and exercise, and it can also be treated with oral medications that improve insulin sensitivity, before some people eventually need insulin themselves. It accounts for the overwhelming majority of diabetes cases worldwide, somewhere around 90 to 95%. Gestational diabetes. This version exists only during pregnancy, usually showing up around the 24 to 28 week mark. Pregnancy hormones make the body naturally more insulin resistant, which is normal, but in some women that resistance goes further than the pancreas can compensate for, and blood sugar rises. Most of the time it resolves completely after delivery, but it isn't harmless while it's happening. Untreated, it raises the risk of a larger than average baby and complications during birth. It also isn't a one-time event in the way it sounds. Women who've had gestational diabetes have a significantly higher lifetime risk of developing type 2 later on, which makes it something of an early warning sign rather than an isolated pregnancy quirk. Prediabetes. Technically not diabetes yet, but it belongs on this list because it's the stage right before type 2, and it's the stage where things are actually still reversible. Blood sugar is higher than normal, but not high enough to cross the official diagnostic line. The frustrating part is that prediabetes usually has zero symptoms, so most people who have it don't know, sometimes for years, until a routine blood test catches it. Left alone, a large percentage of people with prediabetes go on to develop full type 2 within 5 to 10 years. Caught early, it can often be pushed back to normal with weight loss and exercise alone. No medication required. LADA, latent autoimmune diabetes in adults. This one gets missed constantly because it looks like type 2 on the surface. LADA is autoimmune, just like type 1, but it progresses much more slowly, which means it usually shows up in adults in their 30s, 40s, or later, rather than in childhood. Doctors often initially diagnose it as type 2 because of the patient's age, prescribe the usual oral medications, and only realize months or years later, when those medications stop working the way they should, that the immune system has actually been slowly destroying insulin production the whole time. It's sometimes nicknamed type 1.5 for exactly that reason. an adult-onset version of an autoimmune process that behaves like a slow-motion version of type 1. MODY, maturity, onset diabetes of the young. This is diabetes caused by a single specific genetic mutation passed down directly through families, and it's often mistaken for either type 1 or type 2, depending on how it presents. Unlike typical type 2, it isn't linked to weight or lifestyle, and unlike type 1, it isn't autoimmune. It's purely genetic, one mutated gene affecting how the pancreas produces or releases insulin. There are actually several distinct subtypes of MODY depending on which specific gene is involved, and getting the exact subtype identified through genetic testing matters a lot because some subtypes respond well to a simple pill, while others genuinely require insulin. It's rare, likely underdiagnosed, and frequently misfiled as one of the two common types for years before someone finally orders the right genetic test. Type 3C diabetes. This version isn't caused by autoimmune attack, genetics, or lifestyle. It's caused by physical damage to the pancreas itself. Chronic pancreatitis, pancreatic cancer, cystic fibrosis, or surgical removal of part of the pancreas can all destroy enough of the organ's insulin-producing tissue to trigger diabetes as a direct mechanical side effect. Because the underlying cause is structural damage rather than a purely metabolic problem, type 3C is frequently misdiagnosed as ordinary type 2, especially since a lot of the people who develop it are older adults, which is exactly the demographic type 2 typically affects. Treating type 3C means addressing both the diabetes and whatever damaged the pancreas in the first place. Neonatal diabetes. This is diabetes that shows up in the first 6 months of life, and it's genetically distinct from every other type on this list. It's caused by a mutation affecting the very earliest development of the pancreas or its insulin-producing function, and it's rare enough that many pediatricians will only see one case in an entire career. Some forms are permanent, requiring lifelong management from infancy onward, while other forms are transient and actually resolve on their own after a period of months, only to sometimes return later in life. Genetic testing has become critical here because certain subtypes respond surprisingly well to oral medication instead of insulin injections, even in infants, a discovery that changed treatment for affected babies significantly. Diabetes insipidus, the imposter. Despite sharing the name, this one has almost nothing to do with the others, and it doesn't even involve insulin or blood sugar at all. It's a completely different condition involving a hormone called vasopressin, which controls how your kidneys manage water. When that system fails, the kidneys can't concentrate urine properly, leading to extreme thirst and enormous volumes of dilute urine. The only reason it shares the word diabetes is an old Greek root referring to fluid passing through the body. Historically, doctors noticed both conditions caused excessive urination before understanding that the underlying mechanisms were completely unrelated. It's a useful reminder that a shared name doesn't always mean a shared disease. The bottom line: 7 or 8 conditions, one shared symptom, sugar or fluid balance breaking down somewhere in the body, and almost as many different root causes as there are types. Some are autoimmune, some are genetic, some are structural, one is hormonal and doesn't even belong in the same family, and one is really just a warning sign for something that hasn't happened yet. Knowing which type you're actually dealing with changes everything about how it gets treated. If this helped you finally understand what makes each type of diabetes different, do me a favor. Hit like, share it with someone who could use it, and subscribe for more videos like this one. See you in the next video.